The ENT department moved from one location at one of our hospitals to the location that we're at right now. And we decided this would be a great opportunity from the beginning to be involved in their clinic.
We were looking for areas within radiology that we already had enablers in place to have direct patient consultation, and so the ENT Clinic was a natural fit.
ENT surgeons would occasionally ask Dr. Hutchins to stop one in and review a difficult scan, and then I think that's when the aha moment arose for Pat and for Ashley to say, this is an opportunity for us to maybe cook that into the structure of these encounters.
Our head and neck reading room is in the head and neck surgery office space. So the patient exam rooms are lined up around our head and neck reading room.
Having the radiologist interact with the patient is important. First of all, they have a little more credibility when interpreting the images.
Being able to have neuroradiologists right there with that type of expertise who look at scans every day with that much volume makes a huge difference, because then I can go tell a patient, listen, I've spoken with the expert on this. We just talked about your scan and this is what we see.
Instead of me spending 5 minutes talking to the surgeon about the scan, some of that time is just now directed towards direct consultation with the patient.
We're not just reading the scans and putting out a report, but we're actually able to interact with the patients, make sure they understand their disease process, understand their imaging findings. And I think when patients are able to physically see their pathology or lack of pathology, that makes them feel better and feel more involved in their care.
As the experts, I think it's only fitting that the patient now meet with the radiologist, discuss their scans while they're being treated.
As a patient, you don't want to wait any longer than you have to, but in the past, scans would be a week before or so, and you'd wait a week or 10 days to find out results. And now in the process for me, my scan is the day I come in, we have the scan downstairs, come upstairs 15 to 30 minutes later, we meet with the radiologist and Dr. Patel and have that current scan in front of us, and it's all one trip literally within the hour.
We try to work very hard as a system on our patient experience, and we believe the embedded care model that we have in radiology represents all the best of that.
There's nothing as fulfilling for a physician as the gratitude of a patient and the feeling that one's having an impact on the patient, on their care, on their well-being. And the ability and the opportunity to speak with a patient is something that I think most radiologists really enjoy.
A simple introduction can change so much. That the doctor, that the ENT surgeon thinks highly of the radiologist. That the ENT surgeon introduces you and says, this is your doctor that helps us determine whether you have a worrisome finding that we can't see. And then patients instantly have confidence in you because someone that they know has confidence in you.
I feel like a doctor again. I feel like a doctor again. I'm not just looking at pictures.